Hi everyone, welcome back to the Health Nook. And if you are new here, I am delighted you came. Today, we're exploring a topic that many of us deal with, skin tags. If you are at all curious about what they are, what causes them, wondering whether you should remove them, or just want to know what treatment options are available, this is the video to watch. First things first, what exactly are skin tags? Skin tags, medically known as acrochordons, are small, benign growths that hang off the skin. They are typically flesh-colored or slightly darker and can vary in size between 1 and 10 millimeters. Most commonly, they appear on the neck, underarms, eyelids, groin folds, and under the breasts. It is estimated that almost 50 to 60% of adults will develop at least one skin tag in their lifetime, with the chance of developing them increasing with age. They are usually painless, but can be troublesome, as they may get caught on clothing or jewelry like necklaces, which could result in bleeding or itching. Now, you might be wondering why these little guys show up in the first place. Let's break it down. They are made up of loose collagen fibers and blood vessels surrounded by skin. Collagen is a protein that's a key part of your skin structure. When these fibers get trapped inside thicker areas of the skin tags can form. So, what are the causes of skin tags? 1. Friction. Skin tags often develop in areas where skin rubs against skin or clothing. This is why they are common in places like the neck, armpits, and the groin area. 2. Age. They are more prevalent in middle-aged and elderly individuals. Prevalence is higher in people usually in their 4th decade of life and beyond. 3. Genetics plays a role. If your family members have skin tags, there's a higher chance you might develop them too. 4. Hormonal changes, specifically in pregnant women, might lead to development of skin tags due to hormonal shifts with elevation of female sex hormones, progesterone and estrogen. 5. Medical conditions such as obesity, heart disease, and type 2 diabetes, which is the biggest culprit as far as medical conditions go. This is because high insulin levels and insulin-like growth factors in the body can promote growth of skin tags. In some cases, skin tags are an early indicator that a person might be suffering from type 2 diabetes before other symptoms start to manifest. The question you might be curious about is whether or not you should remove them or just let them be. Well, it depends. If your skin tags are causing discomfort, getting irritated, or you simply don't like how they look, removal might be a good option. However, if they're not bothering you, there's no medical reason to remove them. Always consult with a healthcare professional before deciding on removal, especially if you're unsure whether it's a skin tag. Now let's discuss the various treatment options available for skin tag removal. 1. Cryotherapy. This involves freezing the skin tag with liquid nitrogen. It's a quick procedure that causes the skin tag to fall off after a few days. This method is generally best suited to smaller to medium-sized skin tags. It is safe and effective, but might cause temporary redness or irritation. 2. Ligation. This method involves tying off the skin tag at its base with surgical thread to cut off blood flow. The skin tag will eventually fall off. This is a simple method often used at home, but it's best done by a professional to avoid complications. 3. Excision. A doctor can use a scalpel or surgical scissors to cut off the skin tag. This procedure is quick and done under local anesthesia to minimize discomfort. There might be a small scar left behind, but it's usually minimal. 4. Electrosurgery. This technique uses an electric current to burn off the skin tag. This method is best suited for larger skin tags. It's effective, but might require a local anesthetic to manage pain. 5. Laser surgery. A laser is used to remove the skin tag by burning it off. This method is precise and typically results in less scarring. However, it can be more expensive and might not be covered by insurance. What about over-the-counter solutions, you may ask? There are various creams and solutions available that claim to remove skin tags. These usually work by drying out the skin tag until it falls off. However, their effectiveness can vary and they might cause skin irritation. Now let's talk about what you shouldn't do. Avoid attempting to cut off a skin tag yourself, as this can lead to infection or excessive bleeding. Also be wary of over-the-counter treatments that haven't been recommended by your doctor, as they might not be effective and could cause skin irritation as previously mentioned. It's important to differentiate between skin tags and other skin growths. For instance, warts, moles, and certain types of skin cancer can sometimes look similar to skin tags. If you're ever in doubt, see a dermatologist to get a proper diagnosis. You are probably wondering about the risks associated with skin tag removal. Skin tag removal is primarily a low-risk clinic procedure. However, the lesion often freely bleeds when removed, requiring pressure and monitoring during the procedure. In rare cases, the patient may experience heavy bleeding, for which use of silver nitrate to stop the bleeding might be necessary. A patient could also develop an aberrant infection after the surgery. The clinician can mitigate the risk for complications by taking a proper history of any prescription or over-the-counter medications the patient might be taking, since some drugs and herbal supplements can alter bleeding and clotting times. It is also crucial that the patient follows proper instructions on how to care for the area after skin tag removal. This might include keeping the area clean and dry, applying an antibiotic ointment, and avoiding picking at the scab that forms. Using products like antiseptic solutions and gentle moisturizers after skin tag removal can help keep the area clean and aid in the healing process as well, reducing the risk of infection. While skin tags are harmless, moles that change in size, shape, or color should be evaluated for skin cancer. Warts, caused by the human papillomavirus, HPV, have a different texture and appearance. They are usually rough, grainy, and raise bumps as compared to the small, soft, flesh-colored appearance of skin tags. So, to wrap things up, skin tags are common, generally harmless, and can easily be treated if needed. Please remember, the information in this video is for educational purposes only. Always consult your medical provider for guidance on choosing the right treatment option for you. You can find links used to research this topic in the description section of this video. Thanks for joining us today. If you found this video helpful, make sure to give it a thumbs up and subscribe to our channel for more health and wellness tips. And if you have any questions or experiences with skin tags, drop a comment below. We love hearing from you. Until next time, take care and stay healthy.